Dealing with HS is difficult. I have been there, and I'm just so glad that there are solutions now. There's things to help us. We do not have to do this by ourselves, honey. Hey, I'm Frank, TV personality, fashionista, jump rope icon, and a dreamer. And I'm living with hidradenitis suppurativa. I started seeing my first HS symptoms when I was around probably 15 or 16 years old, and I didn't know what it was. You learn in health about the different things that can happen to your body. And I never saw anybody talking about this ever. And it was very confusing, and it was shame behind it. I will never forget graduating undergrad. I randomly had a flare up. I just remember being so uncomfortable sitting in that auditorium, and it's one of my proudest moments. I'm one of the first people in my family to graduate college, and I'm literally sitting on the edge of my seat because I'm in so much pain. I feel like I adapted a lot of things in my life around HS. The first time I decided to go see anyone about this, I was in college, and I went to the doctor, and I called her in there, and I showed her what was going on, and she walked out the room and brought back a whole bunch of interns, other doctors, and I felt like a science experiment. It took a lot of courage for me to go and try to seek help, and she had no answers for me. When I first went to my dermatologist and I literally just told her my symptoms, immediately she knew that I had HS. Getting a formal diagnosis really was game-changing for me because I, for a majority of my life, up until that moment, had absolutely nothing to go off of. So the diagnosis really was just relieving. My dermatologist was recommending me some treatment options, and he actually recommended Cosentyx. And I just remember feeling so hopeful. I started seeing results after taking Cosentyx within several weeks. And I noticed that I wasn't seeing any new flare-ups. And I was like, wow, this is really working. Dealing with HS is difficult. I have been there, and I'm just so glad that there are solutions now. There's things to help us. We do not have to do this by ourselves, honey. Some of the things that I can do now that I actually enjoy are really, really simple things to some people, but they're major to me. White tank tops, love them. White sheets, they're my thing. Going to the gym, feeling free. I want to really do everything that I couldn't do. I feel like I'm like Frank 2.0 these days. The old me would be very proud of the Frank I am today, and I give a large hand clap to Cosentyx for being a part of that change. If I could tell young Frank one thing, it would be to hold on, there's a change coming. And I say that with a lot of hope that someone is watching this will go and seek help. I'm just really grateful, and I hope that people are encouraged to go seek treatment, go ask questions, champion for yourself, and be your biggest advocate.
Indications. Cosentyx, secukinumab, is a prescription medicine used to treat people 6 years of age and older with moderate to severe plaque psoriasis, PSO, that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light alone, or with systemic therapy. People 2 years of age and older with active psoriatic arthritis, PSA, adults with active ankylosing spondylitis, AS, adults with active non-radiographic axial spondyloarthritis, NRAxSpA, and objective signs of inflammation. People 4 years of age and older with active enthesitis-related arthritis, ERA. Adults with moderate to severe hidradenitis suppurativa, HS. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. What is the most important information I should know about Cosentyx? Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Some people have had serious infections while taking Cosentyx, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Some people have died from these infections. Your doctor should check you for TB before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, you may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not use Cosentyx if you have an active TB infection. Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection or have symptoms of an infection such as fevers, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate, or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection listed above. Do not use Cosentyx if you have any signs of infection, unless you are instructed to by your doctor. What are the possible side effects of Cosentyx? Cosentyx may cause serious side effects, including serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash or hives, red itchy bumps. If you have a severe allergic reaction, do not give another injection of Cosentyx. Inflammatory bowel disease. New cases of inflammatory bowel disease or flare-ups can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Severe skin reactions that look like eczema can happen during treatment with Cosentyx from days to months after your first dose and can sometimes lead to hospitalization. Your doctor may temporarily stop treatment with Cosentyx if you develop severe skin reactions. Tell your doctor if you have any of the following signs or symptoms: redness or rash, itching, small bumps or patches, your skin is dry or feels like leather, blisters on the hands or feet that ooze or become crusty, or skin peeling. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory tract infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. Before using Cosentyx, tell your doctor if you have any of the conditions or symptoms listed above for infections. Have inflammatory bowel disease, Crohn's disease, or ulcerative colitis. Are allergic to latex. The needle cap on the Cosentyx Senza-Ready pen and 150 mg per milliliter and 75 mg per 0.5 milliliter pre-filled syringes contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines. Children should be brought up to date with all vaccines before starting Cosentyx. Have any other medical conditions and all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep a list of your medicines to show your healthcare provider and pharmacist when you get a new medicine. Are pregnant or plan to become pregnant? It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed? It is not known if Cosentyx passes into your breast milk. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.